Hello, my name is Ashley Conder, and I am going to be doing my technical demonstration on the heartworm disease in domestic canines. The topics we are going to cover today include the spread of heartworm disease, symptoms and signs of heartworm disease, treatment of heartworm disease, and then prevention and preventative care of heartworm disease. Alright, so we're first going to talk about the heartworm life cycle, and I've included a diagram down here to kind of further show what's happening in this cycle. So the first step here is a mosquito bites an infected dog and ingests the microfilaria during the blood meal. So this dog already has contracted heartworm disease, and this mosquito now bites it and then carries that heartworm disease with it in the form of the microfilaria. And then that mosquito goes off. The larvae inside the mosquito or the microfilaria develop into infective larvae over a period of 10 to 14 days inside the mosquito. And then once this mosquito goes to bite this dog here, who does not have heartworm disease yet, the transmission to the dog includes when the infected mosquito bites another dog, the infective larvae are transmitted to the dog through the bite wound. So right here. Now this dog has contracted heartworm disease, and so the larvae will continue to develop inside this dog here. The larvae will molt and develop into the L4, then L5 larvae stage, as you can see here. They will mature to adults inside the dog. In about 6 to 7 months, the larvae mature into adult heartworms. It takes about 6.5 months for males, 7 months for females. They reproduce and live in the heart and pulmonary arteries of the dog, where they reproduce and release new microfilaria into the bloodstream, completing the cycle. So they live here in the heart, and then as their offspring are the microfilaria, that goes into the bloodstream, and then when another mosquito goes to bite this dog, it will now be infected, and the cycle will start all over again. But the lifespan for an adult heartworm can live for about 5 to 7 years in a dog and up to 2 to 3 years in a cat, according to the American Heartworm Society. So they can carry adult heartworms and be very highly infested with them for a long time. It doesn't take very long to get to that point. Now let's talk about the adult heartworms and where they like to live and hang out. I've included a diagram here of the heart so that you can kind of see how it works. And how they affect the heart and cause issues. So they live in the heart. Female adult worms are about 6 to 14 inches long, and about 1/8 inch wide. Males are about half that size. And then adult heartworms are found in the heart, the pulmonary artery, as I've already said, one of the big blood vessels from the heart, and adjacent large vessels of infected dogs. Rarely worms may be found in other parts of the circulatory system, but female adult worms, like I said, are about 6 to 14 inches long. Males are about half that size. One dog may have as many 300 worms present when diagnosed, so quite a bit of worms there. Adult heartworms may live to 5 to 7 years during this time. Females produce millions of offspring called the microfilaria. These microfilaria live mainly in the small vessels of the bloodstream. So as you can see there, the pulmonary arteries carry blood to the lungs. If clogged with worms, the blood supply to the other organs in the body is reduced. So the more worms that are in there, the more issues that are going to be having, the more blockages that are occurring, and the more symptoms are going to be seen from the dog. Now moving right along, we're going to be talking about the signs and symptoms of heartworm disease in dogs. So some early symptoms include a mild cough that may be persistent. Dry cough is often one of the first noticeable signs. Then there is exercise intolerance. Dogs may tire easily and show reluctance to exercise. And then there is lethargy, which is increased fatigue and a decreased activity level. And a lot of these early symptoms are subtle or not even shown at all, so it can be hard to first detect the heart disease in the dogs, especially if they're not showing any of those symptoms. More advanced symptoms, this is when there is more of a heavy load of heartworm disease and they may have had it for a little bit longer. These include shortness of breath, which is difficulty breathing, especially after exercise, weight loss, loss of appetite, and a noticeable decrease in body weight. Swollen abdomen, fluid buildup in the abdomen can cause swelling. Fainting, severe cases can lead to fainting or collapse just because of that ineffective blood flow. Heart failure. In advanced cases, the heart can be severely damaged, leading to heart failure. And other signs include coughing up blood, nosebleeds, and bulging chest can also occur in some cases. So they're hanging out in the chest, so you have lots of symptoms that include the chest, abdomen, and especially the heart. The heart is trying to make up for putting the extra work in to get that blood flowing, and when those worms are in the way, it's having to work a lot harder. And when the heart has to work harder, it doesn't last as long and it gets tired. So a lot of those symptoms come from that. Now we're going to talk about treatment for heartworm disease. There's lots of different options here. It's kind of a lengthy process, and this treatment plan is always changing according to um, the American Society for Heart and Disease. They're always releasing new protocols, new techniques, and different things that as they find and study to see what is actually effective and not. So they were always releasing new protocols and what it should actually do. So this is just what is the most recent, so it could always change. The first step is the adulticide treatment, so taking care of those adult worms because they are the ones causing the most damage. These include melurosome injections. The primary drug used to kill adult heartworms is imepicide or Daraban. Those are different products that are used. The injection protocol for this includes most dogs receive a 3-dose protocol, which sometimes will change, with injections administering deep into the back muscles, 24 hours apart. Some dogs may receive a 2-dose protocol. I know at my own clinic, we will usually hospitalize these dogs for those 3 days, keep them there with us just to monitor them and make sure they're doing well. Because it is a kind of a painful injection to have, so we like to make sure that they are comfortable and doing well and are on plenty of fluids and things like that. Pain management is also a big thing. The injection is very painful, not only because it's going deep into the muscles of the back, but you have to use a pretty big gauge needle to do so, and which is painful. So pain medication may be given to the dog during and after injections as well, just to help keep them comfortable with that. There is also an exercise restriction. Strict exercise restriction is essential during the treatment to prevent complications from dead worms blocking blood flow in the lungs, which is called pulmonary embolism. So as the worms die, they will be transmitted through the bloodstream and make their way out. So it's very easy that a worm could get in the way and have a blockage. So that's why it's also very dangerous. Just heartworm treatment alone. A lot of dogs don't actually make it through the heartworm treatment, just depending on how heavy of a load they have. The next step of treatment is to address the microfilariae or the immature heartworms. Ivermectin or moxidectin are the medications used to treat the heartworm larva or microfilariae. Present in the bloodstream, doxycycline or minocycline, an antibiotic is given to weaken the adult worms and reduce the risk of complications from their death. So, like I said before, that will help prevent those blockages. There are topical treatments as well. Some topical medications like Advantage Multi for dogs can also be used to eliminate that microfilariae. The next most important part of this is the supportive care. Rest and confinement is very important. Dogs undergoing heartworm treatment require restricted activity and limited exercise to allow their bodies to recover and prevent complications. Monitoring is also very important. Regular checkups and monitoring of the dog's condition are essential throughout the treatment process. There are also potential complications, like I kind of previously mentioned, Treatment can cause complications like pain at the injection site, lethargy, coughing, and in rare cases, more serious issues like pulmonary embolism, which usually lead to death. Next, we are going to talk about the preventative care. This is the most important part of heartworm disease because heartworm disease can't be prevented. It's very important to try to make sure that you are having your dog on some form of heartworm prevention year-round. Mosquitoes, a lot of people think mosquitoes die off in the winter, but that's not always true. So it's very important to have your dog on something year-round and making sure that they are protected. As long as they are protected, you'll never have to deal with the heartworm process in the future. So, once treatment is complete, it's crucial to keep dogs on heartworm prevention medication to prevent future infections as well. So, some different options here. There are oral medications available as chewable or non-chewable tablets. These are common and convenient options. That is the Simparica Trio here shown. This is actually a 3-in-1 product that is offered. It covers flea, ticks, heartworms, and then some intestinal parasites as well. So this is a great option. This is what I give my own dog at home. And then there are topical solutions as well, applied to the skin. These are another convenient option. This is the Advantage Multi here, which also covers fleas and some intestinal parasites, as well as the heartworm disease. And you will see a lot of them that do that just because they have the combined products in them. This one is also convenient, but a lot of people have issues with just because it is a topical product that they're having to put on their dogs, so sometimes it can be kind of messy. And then there are also injectable medications. That is the ProHeart 12 over here. This is an injection that is given once a year, and dogs are protected from heart disease for a full year. This is usually given with their other wellness exam, vaccines, things like that. Another important important part of preventative care is getting annual testing done and just regular testing. Annual heartworm testing is recommended to ensure that dogs are made heartworm free. That is the only real way to know if they are heartworm free. Year-round prevention, mosquitoes, the carriers of heartworm larvae, can present even in colder climates, making year-round prevention essential. Prescription medications, heartworm preventatives are prescription medications, and your veterinarian will determine the best option for your dog based on their individual needs and health status. You have to have a prescription to get heartworm medicine for your dog, so your dog has to be seen by a regular vet to get that prescription. And then there are also some complications that come from different heartworm preventions based on your dog's health status. For example, if your dog has seizures, an oral product would not be recommended just because it is sometimes shown to lower that seizure barrier, and they are more likely to have seizures on that product. So, of course, we will not recommend that. Testing before starting prevention is also very important. Your veterinarian will most likely test your dog to ensure they are not already infected, as some preventives can cause adverse reactions in an already infected dog. I've already gone over the types of preventatives. Even when prevention medication, annual heartworm testing is recommended to ensure the preventative is working effectively and detect any potential infections early. The American Heartworm Society recommends that dogs be tested every 12 months and receive 12 months of prevention care, often summarized as the Think 12 method. In addition to medication, reducing mosquito populations around your home can also prevent heart disease, especially if you know your yard has a large population of heartworms. It might be better to get your yard treated or put some kind of trap out there for them just to lower that population as well. And then lastly, we're going to talk about some important considerations when it comes to heartworm disease. Early detection is the most important. Early diagnosis and treatment are critical for a successful outcome. Like I said before, the heavier the load, the harder it is to get rid of. Individualized treatment, the specific treatment protocol may vary depending on the dog's overall health, the severity of the infection, and other factors. Cost is also a most important consideration because heartworm treatment can be very expensive, ranging from $500 to $6,000. So when you think about, are you going to buy a $30 heartworm pill for preventative care, or do you want to spend that $6,000 on heartworm treatment? So you have to think about those options there. Home remedies: there are no effective home remedies for heartworm treatment, and it's crucial to seek veterinary care. So if you suspect your dog might be positive, it's crucial to get them to the vet and start that treatment. All right, so now we are going to test your knowledge over what I've just discussed. So look over the questions here, try to see if you can answer them, and in the next slide I will show you the answers. All right, let's go over the answers to these questions. So, how are heartworms transmitted to dogs and cats? Like I said previously, through mosquito and mosquito bites. And through those mosquito bites, they spread that microfilaria. True or false? Heartworm prevention is not necessary if a dog is always indoors. False. Mosquitoes can still get inside and transmit the disease. True or false? Treatment for heartworm is easy and inexpensive. False. As I said on the previous slide, heartworm care and treatment is very expensive and can sometimes be up to $6,000 in cost. What is the term for immature heartworm larvae found in the bloodstream? Microfilaria. What are some of the long-term effects of heartworm disease? Some long-term effects include heart failure, lung damage, and other organ damage can occur, as well as many other symptoms that I covered. All right, thank you so much for listening. I hope you learned a lot about heartworm disease in dogs and how to prevent and treat it. Thank you.